Don't miss another update.
I will be talking today about the various do's and don'ts during pregnancy. First trimester is the period of pregnancy from the date of last menses up to the completion of 12 weeks. This is an extremely delicate period of pregnancy because this is the formative part where the pregnancy begins as a small structure and gradually goes into 12 weeks, where almost one can see that the structure is identifiable with tiny limbs, the head and the other parts. The muscles, bones, cartilage and various organs are in the formative form 12 weeks of pregnancy. As soon as the pregnancy is diagnosed, the pregnant girl should identify her obstetrician and start consulting the obstetrician. The hospital also should be gradually identified so that she is at comfort level and knows whom to contact and where to go in any emergency. The next important thing is the intake of folic acid. Folic acid is a part of B complex but is very important in early pregnancy because it is known to prevent certain defects, especially the neural tube defects in the developing fetus. The next important point is the diet. She should take homemade, clean and nutritious food in form of small frequent meals along with liquid diet of about 1.5 to 2 liters. Adequate liquid intake is important because due to nausea and maybe vomitings in some cases, her intake of fluid may reduce and she can go into dehydration, which can be detrimental for the pregnant girl as well as for the developing fetus inside. Antioxidant containing foods are also important. They can be green spinach, then they can be oranges, red apples, yellow banana and blueberries. These can be consumed in adequate quantity because they will provide antioxidants which results in forming a healthy pregnancy and even keep the body of the pregnant girl healthy. Besides the daily routine activities, she should also take adequate rest. If a pregnant girl is driving, she should take adequate precautions of using a seat belt so that she doesn't become accident prone by sudden jerks on the road. Now the next important are what are the things which have to be avoided or precautions or don'ts have to be followed in first trimester of pregnancy. The most important is self-medication. Whenever a pregnant girl in first trimester falls sick, she should ensure that she doesn't pop in any pills from right and left as she was in the habit of doing it before pregnancy, but she should have means of communicating either with her obstetrician or with her hospital to ensure that whatever medication she takes are safe in pregnancy to the developing fetus. The next important is the diet. She should not indulge in fast foods or taking heavy fried food. Smoking and alcohol should be avoided and prevented as far as possible, and once again I will repeat that caffeine should not be taken in large amount but small amounts of caffeine in half or 1 cup or maybe 2 cups of tea or coffee can be permitted, but not in doses higher which can be detrimental for the developing fetus. Raw papayas and raw pineapples should be avoided throughout pregnancy. These two fruits in raw stages have got some toxic material which are said to be detrimental to the developing fetus in utero. Now coming to the second and the third trimester, which I will be dealing together. The second trimester is defined as the period of pregnancy from the onset of 13th week till the end of 28 weeks. This is the time when baby is forming all these structures as well as the organs and is gradually gaining functional maturity. The third trimester is defined from the onset of 29th week till the delivery of the baby. This is the time when the baby is getting full functional maturity, is gaining weight and is coming into a proper shape of a baby. The topmost is the diet. Now the baby's demands are increasing. The baby is forming the bones, cartilage, muscles and the organs. So the mother it is very important for the mother to take a proper diet. She should take a high protein diet, a diet which consists of adequate milk and the milk products. It is very important to take adequate milk because there is a high requirement of calcium. Ideally speaking, she should take 2 glasses of milk and 2 cups of curd along with other milk products like paneer and cottage cheese. Coming to the protein, protein again is a very important component in the diet of a pregnant girl. Protein is required for the formation of the fetus inside in form of once again the bone, cartilages, the various organs and the structure of the baby. The protein requirement is about 100 to 120 grams per day for a pregnant girl, for which she has to eat adequate proteins to make the fetus into a healthy one. Now next is the posture when she is lying down. Ideally, the pregnant girl from second trimester onward should be lying on her left side, on the left lateral position as we call it medically. This posture gives increased blood supply to the uterus and indirectly helps the growth of the baby. If a girl is tired lying on the left side, she can take a right turn, but at no point of time she should have prolonged lying down on her back. When she lies on her back, the gravid uterus presses upon the major blood vessels which are going through the back of the pregnant girl, and that will hamper the blood supply to the uterus and can sometimes affect the growth of the baby. The next important thing is to follow the exercise schedule. All girls in uncomplicated cases are advised to follow the exercise schedules which are called the prenatal exercise, including prenatal yoga, lamas, and at the same time have a schedule of regular walks. By doing exercise, there is blood circulation is increased throughout the body. The girl feels healthy, is able to overcome the lethargy which is induced by pregnancy hormones and feels fit. Exercises, yoga also help her relaxing all her joints and give her power to the back muscle, the thigh muscles, which are helpful at the time of delivery. Dental hygiene is very important in pregnancy because if the dental hygiene is not kept up to date, there is a risk that dental sepsis can affect the heart of the pregnant mother and which can make the pregnant mother sick. The next important action that a pregnant girl should take is to take care of her abdominal wall. The abdominal wall is under constant stretching due to the increasing uterus and the increasing bump. This skin can have rupture of the elastic fibers which are underlying in the layers of the skin, and that will lead to stretch marks. By keeping the skin soft and supple by use of various moisturizers, oils and cream, the skin can be taken care of and the elastic fibers may not rupture and they will prevent having stretch marks. We have few don'ts also in the second and third trimester, although there are not too many. But one of them is to take a healthy food and avoid fast foods and junk foods, and once again the street foods, to prevent any infection, to prevent any unnecessary weight gain which can predispose them to getting diabetes and maybe blood pressure. Smoking and alcohol should be totally avoided because smoking especially will lead to growth retardation of the baby and can lead to pregnancy complications like premature rupture of membranes and premature delivery. Overexertion and too frequent long travel should be avoided because they can lead to unforeseen complications like premature labor pains, premature rupture of membranes and other complications like bleeding or other complications. And lastly is that sexual contact should be avoided in the 9th month of pregnancy so as to prevent any complications like ascending infections or premature rupture of pregnancy.